My name's Susan McKinnon. I'm going to briefly discuss our paper on empowering patients to help us with this opioid crisis. We all know we're in the midst of an opioid epidemic. We don't need statistics to tell us that, but I'll give you just a couple of statistics. In 2013, over 30,000 people died of opioid overdose. In 2016, over 64,000. In the 19 and a half years of the Vietnam War, 58,200 people died. This is a big problem. It's multifactorial. We know that we as physicians can work on not overprescribing opioids, but this paper that I'm going to discuss was looking at another way to help combat this big problem, and that's empowering our patients to help get rid of the extra opioids and pain medicines and sedatives that they're not using. We started this by talking to our patients about the problem. And when we did that, we had 11% get rid of unused opioids. Then we developed this 3-part brochure, lots of information, every way that the governing bodies say you should get rid of opioids in a safe way. Lots of pie charts, because we know our patients love pie charts. And when we did this, as reported in our study, we increased the relative disposal rate by 100%, but that just took us to 22%. We believe that the simpler the ask is, the simpler the education, the simpler the request of our patients, then the more likely we are to be successful with getting these opioids that aren't used out of the medicine cabinets and away from the possibility of friends, family, strangers taking these drugs and hurting themselves. So here's our 1-page brochure that we're using now. Yellow and orange, alert, there's problems potentially in your medicine cabinets, not just our patients, but in everyone. And green, this is what we want you to do, 1, 2, 3. Plastic throw-out bags, some dish detergent, and check your medicine cabinet. These are some antibiotics that I'm allergic to, that's why they're there. Here's a little Ziploc bag, 3 pills. Don't even know what they are, left over from something in case we might need it. So, dish detergent. There we go. For our demo today, an hour and a half ago, I put some of these drugs in here, and you can see they pretty much in an hour and a half turn to mush. Go where they belong, in the garbage, in the garbage. One more demo. This is a terrible problem that we've got on our hands. We have to do something about it. I personally don't want any of my grandchildren overdosing by finding something to experiment with in my cupboard. So this is what we're doing now. We're asking our patients to help us be a part of the problem solving. We're empowering our patients. We're doing it at grassroots. And I would ask you to go to your medicine cabinet, tell your friends, family, and patients, and help us get rid of this problem. Thank you so much.